Congress is debating a massive and costly overhaul of health care, a plan the Congressional Budget Office says will add more than $1 trillion to the federal deficit over the next 10 years.
In the legislation that has been reported, we do not see the sort of fundamental changes that would be necessary to reduce the trajectory of federal health spending by a significant amount. And on the contrary, the legislation significantly expands the federal responsibility for health care costs.
But more than 80% of Americans say they're satisfied with their current coverage. Most of all, they want patients and their doctors to make the important decisions, not some government official. So, what's in the federal plan? The 1,000-plus page proposal in Congress. Some who've read it are shocked at what they found. One version of the bill would spend billions on streetlights, sidewalks, bike paths, and farmers markets to encourage healthy activity, but would ban insurers from offering lower premiums to people with healthy lifestyles. And it is still not universal care, leaving some 17 million people without coverage.
So Congress is trying to take over our entire healthcare program in this country. Well, we don't have to look any farther than the state of Massachusetts that tried this in 2006. They wanted universal health care. They wanted every member of their state insured. And let's look at what happened. Well, they now have cost overruns of almost $1 billion. They've kicked 30,000 people off of the rolls. They're not talking about universal health care anymore.
Nevertheless, supporters say this should be the model for national health care reform.
Hawaii tried a program for their children's care, universal health care for their children. That lasted 7 months until they ran out of money and decided, oh wait, we can't afford this.
Proponents say you'll be able to keep your current coverage if you want, but that is simply not true. The government will set a mandatory standard for benefits. If your plan doesn't comply, you'll lose it. If your employer switches to a public option, you'll lose coverage. Congress has put the bill on a fast track, but what's the rush?
As a physician, I can tell you that health care is very important. It's too important to let the government ram through a project that's poorly conceived or poorly thought out.
Your health is on the line. Learn more. Get involved. Speak up.